A facelift surgery, like any other surgery, has its risks. Obviously, there are certain risks which are shared by all surgeries. So, infection, bruising, swelling, bleeding can happen with any surgery. Your sensation around the skin, which is cut and which is lifted up, will be slightly distorted and damaged, and that will take about 12 months or so to become normal. The scars in facelift surgery are placed in such a way that they're very hidden, but there's 1% risk of having bad scars or scars which will need treatment. And sometimes the scar, particularly around the earlobe, can become very tight, and earlobe can give a pulled appearance, which is called pixie ear. But the most important risk of any facelift surgery is the damage to the branches of the facial nerve. Facial nerve is the nerve which moves one's face, and it originates in the brain and obviously comes out at about the level of the ear, very deep down. It comes out of the skull and then swings forward and is lying under the parotid gland, which is the salivary gland underneath the muscles of the face. But as you move forward, almost at the junction of a line drawn from the corner of the eye, the nerves become more superficial, and they divide into 6 nerve branches, supplying the temple, eyes, lips, neck, and lower lip. And of these, all these branches are at risk, but the lip and lower lip branches are particularly at more risk because of their positioning. There are 3 kinds of damages which can happen to the nerve itself. They can be a transient damage, which means that nerve is paralyzed for a few hours to a couple of days because of the pressure, swelling, and anesthetic. There can be a temporary loss of function because the nerve has been damaged in such a way that it stops functioning for a few days to a few weeks because of, again, swelling or bleeding close to the nerve, or due to cautery damage close to the nerve. And then there is actual cutting the nerve, transection of the branch of the nerve, which fortunately is very rare, although various studies will quote a risk of anything from 0.04% to 12% risk of nerve damage. But in an experienced hand, that is an extremely unlikely scenario to happen. And if that happens, and if one identifies that the nerve is damaged at the time of the surgery, you kind of suture it back straight away, which is one reason one would want to do the surgery under local anesthesia, because you'll be able to ask the patient to animate the face and see if the nerve has been damaged or not, if you were suspecting a nerve damage. Compared to that, if you were being put to sleep, then the only way of doing the surgery would be knowing about the nerve damage would be a nerve stimulator surgery, nerve stimulator to stimulate the nerve, and one would recover there. But say if it was discovered afterwards, again, fortunately, in most cases, nerves recover, and although it can take anything from 6 months to two years to have full recovery, so it is rare that a permanent and lasting damage is created after the facelift surgery.